Welcome to Stay Healthy Doctor Talk Facebook Live program by Bumrungrad International. So we are honored to have with us here Dr. Vachara Phumprade, our infectious disease specialist. I would like to share a little bit background of Dr. Vachara first. He graduated from the Prince of Songkhla University, Thailand in 1995. And then he became a diplomate of the American Board of Internal Medicine in 2000. And then he continued his fellowship in infectious disease at University of State of New York in USA from 2000 to 2002. And he became a diplomate of the American Board of Infectious Disease in 2002. And then he came back to Thailand and then got the diploma of the Thai Board of Internal Medicine in 2004. His special clinical interests are in HIV/AIDS and sexually transmitted infections. And I am Dr. Zani Min, and we will discuss living a normal life with HIV. So during Facebook Live session, if you have any questions, and then you could leave your questions in comment box, and then we will answer after our discussion. So without further ado, we will now start the Doctor Talk session. So, Sawasdee krab, Ajahn Vachara.
Sawasdee krab.
Thank you very much for being with us here today, Ajahn.
Thank you for having me as well.
Ajahn. So when we say about HIV, so most of the people, they feel very scared,
right.
And then there will be negative impact from it, like whether people will think about them getting HIV infection, or so. Right. I would like to know what is your opinion on their perspective.
Yeah, that's true, Dr. Zani, because HIV has been around for over maybe 30 years, right? In the beginning of the epidemic, especially here in Thailand or Asia in general, HIV had no effective treatment, right? So at the time when there was no effective treatment, the prognosis, so how patients are doing, was actually pretty bad, right? Plus the social stigma of the people misunderstanding about HIV as well. But nowadays, it's very much different landscape, because nowadays HIV is a treatable or manageable disease. It's not anymore a disease that you will get it and then you will get the severe complications, or you can die from it. So I want to look at HIV just like diabetes or high blood pressure, right? Diabetes is not curable yet, right? Yes. But they are treatable, they are manageable, and the most important thing is that people with HIV infection nowadays, if they're on treatment, okay, I have to emphasize, if they are on treatment, they will have good quality of life. They will have, life and the career as what they expected. And they can have family, they can love, they can have sex as normal as people without HIV infection. Yeah, so that's definitely doable right now.
Yeah. So nowadays, HIV is not a scary disease anymore as before.
Right, it's not. However, this is extremely important point to make here, is that for those HIV infected people who present to doctor for the treatment early, they do a lot better, compared to people who actually have HIV and are not aware that they have HIV. And they wait for, let's say, 8 years, 9 years before they enter the treatment. The prognosis, so how well they do after the treatment, for those who wait for a long time is much worse than those who enter the treatment early. So that's a very important thing to actually get HIV testing, right? As early as possible. A lot of my patients who present early, they look at HIV testing just like you go in to check your blood sugar to know whether you're diabetic or not, right? I want to look at it that way, right? But a lot of people out there still feel hesitant to come forward for HIV testing because they feel scared. They feel like, oh, if I know HIV is a death sentence, or if I know HIV, it will affect my social status and stuff like that. So we here at Bumrungrad would like to encourage everyone who are sexually active or any chance of having HIV infection to come forward for HIV testing. It's simple, it's cheap, and it means a lot to your health. Like I said, I want to stress this again. The earlier you get into the treatment, the much better outcome of the treatment, right? And the other thing about confidentiality, Dr. Zani, because I'm sure that a lot of clients or patients, when they come to the hospital, they feel like, oh, will my information about HIV status be disclosed to a third party or not? At Bumrungrad Hospital, you can be 100% confident, 100% sure that the results of HIV testing, HIV status, will not be disclosed to any third party without your permission. And in Thailand, it's a law, right? We as clinicians are not allowed to tell anyone, about your HIV status, and our governments are not interested in knowing. So if you come to our hospital, getting blood tests, going to the treatment is all completely confidential.
I see. So, who should get tested for HIV? And like, if a person is like exposed to the risk of getting HIV, and how long they should wait to get tested?
Yeah, that's a great question. So anyone who are sexually active, right? Or anyone who has any possible risk to HIV infection, you feel like, okay, you have monogamous relationship, but you do dental work in clinics where you don't trust, you can also get tested as well. So the more you test, the earlier we can detect an infection. So everyone who's sexually active should get HIV testing. I would say at least a year, but nowadays we actually recommend at least twice a year as well, right? And not only HIV, on top of HIV testing, we should also look into STD testing. STD stands for sexually transmitted disease or sexually transmitted infection. So like syphilis, hepatitis C, hepatitis B, all of these are curable, are manageable, but if you wait and being in the unknown for a long time, the outcome of the treatment is far worse than early treatment too. So,
see. So some people, they think that HIV and AIDS are the same thing. So what are the differences between HIV and AIDS?
Yeah, we used to put AIDS and HIV in a different spectrum. AIDS means that you have HIV infection, and then you also have developed opportunistic infections, complications from HIV. Again, when you have HIV infection is a virus, right? It goes into your immune cells called CD4. That's kind of a technical term, I'm so sorry. But CD4 is your immune cells, which helps you to fight against all of the infections. For instance, pneumonia or fungus infection of your brain, right? So if you have HIV infection and you don't treat it, then your immune system will get very weak to the point that you can get additional infection from opportunistic infection, or we call it OI, like pneumonia, tuberculosis. That's when we call AIDS. But if you only have HIV infection alone without any opportunistic infection, so that's pure HIV infection. So yeah, it's useful in a way. But again, though, I want to re-emphasize again, I'm saying this third time, I know, but try to test regularly, every 6 months. If things can't turn out not as you expect, if you happen to have HIV infection, it's not the end of the world. Look at it just like diabetes and hepatitis B. Will you be losing your sleep if you get hepatitis B positive from the testing? No, right? Yes. So HIV should be pretty much the same thing, because we do have very good treatment to offer for HIV infection. You have life expectancy comparable to people without HIV infection. You can work, you can do well in your career, you can do the startup. All of these questions are being asked all the time, whether what they can do, right? Yes. So basically, you can do anything just like you're not infected with HIV, you can have family, you can have kids as well.
Yes. So, like, if a person like worry about the getting infected, then he can to have HIV blood test, and if the test come out positive,
right.
So what should he do first?
Yeah. So, if the results come out positive, so that's a confirmed positive test, right? In Bumrungrad, we'll have the a screening result of the screening test within 1 hour, 1.5 hours, and then we do a confirmatory test about 2 hours. After that, then we go ahead and start the evaluation for the treatment. For instance, we want to evaluate your number of HIV virus in your system. We want to evaluate your immune system. We want to look at the chest X-ray and also resistance test. So all those lab results will take about a week or two before we can start the treatment. So I will recommend to start HIV treatment about 2 weeks after the positive results from the screening. And I forgot, you also asked the other question about if you're exposed to HIV, if you have like unprotected sex today, when should you get for HIV testing, right? I would recommend a month after your exposure. Okay? That would be right timing to get tested for HIV, right? If that's negative, some people might want to repeat it again at 3 months after exposure. After 3 months, if all the tests come back negative, it means you do not have HIV infection. You can close the case, right? However, Dr. Sani, you bring up this very interesting point, is that if I'm exposed to HIV today, if I have sex without using condom, then besides doing screening, we also have other prevention treatment called post-exposure prophylaxis, or taking medications after you have exposure or possible exposure to HIV. This treatment uses the same medication as treatment, but you want to use it, the medication, within the first 3 days after exposure. And you want to take it only a month, okay? That medication called PEP, or post-exposure prophylaxis, it prevents you from HIV infection of about, I would say, 70 to 80%. And that's a lot of protection compared to doing nothing, right? So that's PEP as well. So I think that's a nice information to talk about with screening technology too.
So PEP can protect only 70%, right? So yeah, people, they have to prevent without getting exposure to the risks, right? So is there any your advice on how to protect for the not to expose?
Yeah, you mean after the exposure, right? If they have unprotected sex, or prevention in general?
Prevention in general.
Yeah, so I want to finish up the prevention of PEP. If you're exposed, you're taking PEP, and you want to prove it whether you get infection or not in a month, right? So within that 1 month, you're not sure whether you're going to infect your partner, for instance. So you want to refrain from sexual activity for a month until you prove that you do not have HIV infection. But general HIV prevention, that's hot debate, right? Yeah. There's a lot of developments and innovations in this field, which is a good news. Traditionally, as you know, the way to prevent HIV infection would be using condom, right? So using condom right from the beginning until the end of your sexual activity, right? That will protect you almost 100%, and condom is still a very great thing. So not only it prevents you from HIV, it also prevents you from STD as well, okay, and also unprotected, unwanted pregnancy. Yeah, that's right. However, there are new therapy called pre-exposure prophylaxis. Pre-exposure prophylaxis meaning that I take medications before I exposed to HIV infection. So that will be like taking 1 pill a day, and you take it for about 7 to 14 days before you start to live your life, right? But you have to take it every day. That will protect you over 90% in men, and in some, to be honest with you, in some cohort, it's almost 100% protection.
Wow.
So nowadays, people taking PrEP or PrEP, pre-exposure prophylaxis, together with condom, that will protect you from HIV very effectively. So I definitely recommend you to look into that and do some research on PrEP. But if you have questions about HIV testing or PrEP or PEP, you can always contact us through our Bumrungrad telehealth, and we have clinicians and specialists to give you the consultation online, and you can get blood tests wherever you are in your locations, and then get the consultation online with us. So that's very highly recommended.
I see. Okay. So a lot of people also worry that like if they got infected with HIV, so what would that mean for their future, and also what other people would think about them. So when people get when a person get infected with HIV, so what should they? Could you please advise like how should they live with this, or how to take care of themselves?
Yeah, so good. So personally, in your personal life, not much difference. You can be living with your family. You can eat together. You can, even share utensils. It's okay. You can use the same bathroom. Mosquito bite you and bite your family members. It will not transmit HIV infection. You just have to be careful about two things. One thing is sexual contact. So if you positive and you have sex with your wife, for instance, or having sex with your partner, you want to use condom consistently, 100%. And on top of that, your partner can take PrEP or pre-exposure prophylaxis together too. That will also increase the protection to almost, I would say 100%, right? Now, the other thing also, you have to be careful about using sharp objects like nail cutter or razor, not to share them, because that you can transmit the virus as well. But apart from that, you pretty much have normal life with your family. Now, about public understanding about HIV, obviously the understanding by the public about HIV infection still lags behind what's going on in terms of medical field. So some in general community might not be totally aware of the development of HIV treatment, right? So I would say to prevent from social stigma, you want to tell those who you trust entirely that they will keep your confidentiality completely, right? So I'm not going to go ahead and tell people, but you can have maybe your friends, your family members, a few, so you can actually talk to when you have HIV infection. And to be honest with you, it's going to be only difficult in the first few months after the HIV diagnosis, and that's natural, right? Because you are diagnosed with HIV infection, so you're scared, and lots of things coming into your mind, right? But it takes about maybe 2 or 3 months before patients can get confident again. And then now all of my patients are doing very well, living their life normally, and very well psychologically, mentally as well. So HIV is not their first problem anymore. It's probably same like us, career, retirement, or their family. So again, I'm being honest with you that having HIV, you can lead a normal quality of life.
I see. Okay, so you mentioned about PrEP, and like the partner can take PrEP.
Yeah.
So if a partner has HIV positive, so their partner should take PrEP as well. So how about condom, like PrEP and condom together, or like some prefer not to take like condom prevention, like while they are taking PrEP. So what is your advice on this?
Yeah, what the best advice would be, I would call dual protection, right? Because condom sometimes breaks. And we see that all the time when people coming for PEP, right? So condom can break if you don't use it properly, if you don't keep it well. So PrEP is a cushion, right? So it's a second line prevention. So if you use dual approach, PrEP and condom, that will protect you very well, right? Unless, if you are in monogamous relationship and you know your partner very well, your partner is taking HIV treatment
yes.
until your partner's viral load is not detected, then you're taking PrEP, and the chance of having HIV infection is very, very slim, right? Yeah. So this is also the other important thing as well. We forgot to talk about it, is that if I'm infected with HIV and I take medications very well until virus load is not detected in my system, what are the chances of transmitting viruses to others? Very, very, very slim as well. So it's difficult for HIV-infected people who are taking medications very well and undetectable viral load to transmit the virus. And that's the reason why we encourage everyone to come forward for HIV testing, get into treatment, and making sure you're taking the treatment very well until viral load is not detected. Then HIV new cases will be zero one day. I just had a talk with the Ministry of Public Health of Thailand this morning about dual protection. So this is one strategy to get everyone testing, get everyone treated, right? And people using condom together with PrEP in the risky situation, then we hope we have zero new case in Thailand. So this is really meaningful.
Okay, once the test is positive, the treatment can start like after 2 weeks, like after all further investigation. So how often they need to come for follow-up to get the treatment? Yeah, great question. In the beginning, maybe I'll see them again in 1 or 2 months, making sure that they tolerate the medications well. And if things are okay, stabilized, we can see them every 6 months. So we have patients flying all over from all over the world, basically, and come in for the medication refill. So, but if you come very, very far away from, like Western Europe or America, maybe you can get refill for a whole year as well, making sure that, provided that they have some labs monitoring at home too. So, and nowadays with COVID-19, we also do offer treatment by telehealth as well. They can get their blood test in, for instance, Indonesia. They can present the results to us, we review them, and we do some consultation online, and then we ship the medications to their home. So that makes life a lot easier for our patients too. I see. So for those people like taking antiviral medication, so what kind of side effects they have to observe, and then they have to be careful.
Right. 20 years ago when I started this career, the medication was full of side effects. But nowadays, the new modern medication for HIV are so effective and so little side effect. Obviously, there could be some mild dizziness, mild nausea in the beginning, but usually in the first 2 to 4 weeks, right? But after that, people don't feel much. But there are some long-term side effects that needs to be monitored, like bone health, like cholesterol, like heart diseases. So those are the things that we as clinicians work with our patients to monitor them and to prevent them. HIV infection nowadays is a different landscape. Yes. In the past, we look at it as infections, or severe infectious complications. But nowadays, it's actually non-infectious complications. The complications that we happen are like heart diseases, diabetes, or cancers. And this usually caused by 3 big drivers. One is smoking. So for every HIV-infected patient, we do encourage to stop smoking right away. 2 would be regular exercise, right? Because that's definitely needed. And 3 would be healthy food. It's more and more clear that the more animal-based food, like processed meat, that's the most risky category of food, like hot dogs and bacons, red meat, milk, or AIDS can increase the NCD or non-communicable diseases complications like heart diseases, diabetes. So we want to reduce that, and we want to increase plant-based diet, lots of fibers, legumes, vegetable, tofu, all of these are Asian food. And then, and fresh vegetables and fruits. So these three factors are very crucial in preventing non-infectious complications of HIV. So that's on top of other things that you need to do. I feel like I'm taking care of HIV patients nowadays, just like I take care of diabetic patients. It's the same sense,
So the regular follow-up is important for them.
Right. Regular follow-up, and remember to work on three big drivers. Yes. Smoking, diet, and exercise. Right? The medications nowadays comes in as oral, as pills, right? So you take pills every day. It's great. It's not much side effect, but to be honest, some patients get tired of it after 15 years of taking medications. However, there are some development in the pipeline. We will have treatment which is far better, like injection every 1 month, injection every 2 months, or we will eventually, what I hope for would be the implant. Just like when you have the contraception. Right? So implants will come and maybe stay for the whole year, so people don't need to take medications every day. So, stay tuned, because there are some exciting developments in the pipeline, and definitely Bumrungrad will, make those available for our patients here. So, I hope after, listening to our talks, you have to get a good impression about HIV, and good future waiting, right? So it's really much better than 20 years ago.
So, where like HIV became a manageable disease, and then and also the outcome is very good.
Right.
Like they can live normally with their family. So, but you mentioned about when they found out that they get positive result, like there will be like 2 or more months, like they feel depressed and feeling down. So during that period, is there any special advice for them to prepare, how to prepare mentally?
Right. When you have the HIV diagnosis first time, like I said earlier, it's natural to feel depressed, it's natural to feel anxious, and too many thoughts coming into your mind at one time. But, keep a simple message before you leave the doctor room is that this is a treatable, manageable disease. You will have HIV infection, but you will have good quality of life if we work well together, if you come in for regular follow-up. And all of this worry will come back once you leave the doctor's room, right? Because when you go home, you're alone, you feel anxious again. So please come back if you have some more questions, because you need to clarify a lot of questions with clinicians, right? So this is on the clinical approach. However, there are some community support in, I would say, every country right now. There are peer support. There are government hotline where you can call in and get consultation about HIV disease, how you manage your health, how you manage your insurance, for instance, in every place. And there's some, like in Thailand, we also have peer support group where they get together both online and offline, right? And then giving support to each other. In those groups, there are more experienced HIV infected people who have been through the whole thing and can advise you how you navigate this new diagnosis. So always get help. And some people will find people in their life who they can trust, right? Their siblings, their family, their friends, and then get consultation from those. So you do definitely have the support. If, I don't think it's going to be as scary as it was 20 years ago. I mean, 20 years ago, people with first diagnosis might commit suicide, but not anymore nowadays because it's not that bad anymore, right? So, but if worse come to worse, that you really cannot get your anxiety and depression out of your head, maybe you need a professional psychologist or psychiatrist that can also help you as well. But, but I feel that we don't need to go that far, nowadays. And this is all because we do have such an effective treatment to offer. We have much better technology. We have much better understanding, even though not yet completely from the public, right? But much better understanding, much less social stigma nowadays. So I think it is something, again, manageable nowadays.
See. So the support and understanding from the family and the society is also important.
Yeah, exactly, right. So that's why, apart from seeing patients in the room, we also need to work with our colleagues who are doing community work to get the understanding across. But like I said, it's much better than in the past, right? So social stigma, I mean, this is maybe part of the discussions as well. Social stigma can happen with every diseases, and it's caused by misunderstanding of the public in general or the society. However, from our research, when we done in the community research, it turned out that the worst stigma, okay, listen to this carefully, the worst stigma of HIV infection is not by the society, it's actually the self-stigma. Yeah, so we just feel that we're not normal, we just feel that we're not as healthy as others, we just feel that we're going to be discriminated against, right? So it's all in our head.
Sometimes guilty themselves.
Right. So self-stigma is actually more damaging than social stigma. So how do you tackle self-stigma? So with the understanding, right? Talking to us, get the full understanding, get the peer support. And like I said, it takes maybe 3 months to get your confidence back again, but it will be back and you'll be living your life healthy and happily again.
So how about the family? How the family can provide support to their family member who get HIV positives? Yeah,
2 things, and the 2 things comes into one word with the understanding the disease. If the patient get infected, seeing a doctor, finish already, maybe when you are ready and you think you will tell your family member, you can bring your family members along. That happens all the time. We do family therapy too. So once their parents understand HIV disease, their sibling understand, then the whole temperature goes down, right? Because the family happy again. Yeah? And the other thing would be understanding their lifestyle, because I think what's lying behind the social stigma of HIV infection is the reason why they get HIV infection. For instance, if you are men who have sex with men, which is widely acceptable right now in the society, right? But if your family don't understand your way of life, not understanding that men can love men, then that also put a lot of stress. There are a few gentlemen in my cohort that said out loud that HIV infection is actually less stressful compared to social stigma against the men who have sex with men lifestyle, right? So the family also need to work to understand. I said work to understand, because understand not easy. Eh? Yes. So you have to work to understand that men who have sex with men or drug users is the lifestyle, and it is something that you need to be supportive, right? If they're totally committed to lifestyle of men who have sex with men, then they support them, cherish them. But if they have a lifestyle using IV drug users, maybe they need additional support to stay away from it, to go for the harm reduction with the government program. So there are things that you can do, but most of my HIV-infected patients, after they know diagnosis, they actually become healthier because they come to sit down and reflect on their lifestyle and their family values. And once they understand it well, they take better care of themselves. They stop smoking. They start to exercise. They start to eat healthy, and they start to appreciate the love and understanding in their family better. So it's not all that bad. Huh?
Okay, so with the support and understanding from the family and the community, and also with the effective treatment by the modern medicine, so HIV is not as scary as before.
Right, right. It's just another disease that needs to be taken care of well.
Yeah.
Okay.
I think there are some questions from the audiences. Yeah, so let's go through with their questions. One question is, how long can a patient living a normal life with HIV?
Yeah, like I said earlier, the life expectancy is comparable to those who do not have HIV infection. So if you are in the treatment well, you take your medications well, you work with us very well, then the reason for dying is just like us. Cancers and heart diseases and strokes and all of those. So I cannot give you the number, because if life expectancy in Thailand is 75 years old as Thai women, probably you are 75 years old too. But if you don't exercise, if you're still smoking, then that's the same like us. If we do smoke, maybe we die earlier. So it's comparable to people without HIV infection. However, by having HIV infection, the chance of having NCD or non-communicable disease or non-infectious complications is higher. So that's why you need to be serious about sitting down, planning. Okay, this year I'm going to lose 5 kilos. This year I'm going to eat healthy. I'm going to do plant-based, 1 meal a day, or plant-based 1 day a week, right? And then try to increase it gradually. And this year I'm going to stop smoking in 2 weeks. But I actually recommend, if you want to stop smoking, stop now. That's the most effective approach.
I see. So we mentioned about HIV became like a chronic disease and can be manageable. And one question came out that HIV can totally be cured.
Yeah. That's what many scientists and medical professionals are going after globally right now. We have some lights at the end of the tunnel, because I think you have heard of the cured HIV case in Berlin several years ago because of bone marrow transplantation. When we are infected with HIV, it goes into every cells, including white blood cells and brain cells, right? That gentleman in Berlin, he's got leukemia, and he had another reason to ablate or destroy all of his white blood cells in his bone marrow and replace it with a new cells and new bone marrow. And that new bone marrow from a donor has deficiency in HIV receptor. It means that white blood cells, HIV cannot enter. Doesn't have a receptor. So he was lucky. Right. He got a new bone marrow, got a new white blood cells, and the HIV cannot enter, so he was declared cured. So coming out from that, we have developed many strategies. Like, I would say, I would take your cells, right? This is one of the strategies, huh? And then I would re-engineer your DNA in your white blood cells and make it CAR T cells, we call, or cells. I can inject it back to you and have these cells go and eat all of the virus cells in your body, right? Or infusion, I take out the cells, making your cell as cells that HIV infection cannot enter, then I can reinfuse it back. Or bone marrow transplantation, for instance. So those are not yet a proven therapy, but there are ways to do it. And I would say it will come sooner than we thought because of two things. One thing is an explosion in the knowledge in the genomics or the gene therapy. And the other thing would be an explosion of the computer capacity, so that when we do genomic sequencing, we can analyze it much faster, so the new knowledge actually occurs much faster than in the past. And that's why I think we are seeing brighter light at the end of the tunnel every year. Forgetting about COVID-19, that kind of, kind of distract the whole world attention from HIV. But eventually, I think we will find the way to cure. But even not cure, Dr. Sani, think about if I have HIV treatment like implant. If I put an implant in my arm, it stays for a year. Or I think they can be done in a way that it can stay for 3 years in the future. If you make it every 3 years, right? Yes. So you change it, 10 times, you have 30 years already. Yes. Right? So even though it's not curable, but it feels like it's already cured. Sure. If that type of treatment is on board. So in parallel, we're looking for the way to cure, but the other way to make the treatment as simple as possible too. So looking into genomics and cells therapy will be the way to cure HIV.
Yeah, so can we take this as a good news for the upcoming new innovation and the development to cure HIV?
I think it's not yet a good news, but it is a good hope, right? That there are ways to do it, because we have that one Berlin gentleman who was cured by bone marrow transplantation. We replicated, not me, but I mean the researchers in Boston replicated the bone marrow transplantation, but that one didn't work well like in the Berlin cases. We are doing in other places as well. So, but there are approaches we can go after the cure. And like I said, the explosion of knowledge is so fast nowadays. So I think soon we will have the curative therapy.
So one question is, can HIV patient have baby?
Yes, we mentioned earlier, by having HIV infection, if you treat yourself well until your viral load or HIV virus in your system is not detected anymore, then you can have a baby. If the infected patient is a man, right, you can do sperm washing and then can inject into the lady, or you can do IVF, right, where here in Bumrungrad we also do IVF for this type of patients as well. And if you are a lady, you can also be pregnant and deliver a healthy baby too. I had a very young mother who's been infected with HIV from her mother since birth. Now she becomes in her 20s, and she decided one day that I want to become a mother, but this is all about planning, so we need to sit down, talk about it, prepare things well. And she just had a baby, and now her baby is a 1-year-old boy, very healthy and no HIV infection. So everything can be managed if you plan well. And this is not only family planning, but also HIV prevention too. I talk about PEP, or post-exposure. That's about 70 to 80%. But if you plan ahead of time, you feel like, Songkran is coming. I'm going to have some sex or risk, right? Then I want to take pre-exposure prophylaxis. Then if you plan ahead of time, the efficacy of the prevention is actually much higher than emergency treatment.
So one question came up that if there is one pregnant mother and she's not getting any treatment for HIV, so her baby will get HIV for is there how many % risk of getting HIV?
Right. Yeah. So that's risky. So I would say maybe 2 to 5% chance of having infected baby. Right. So I'm sorry, 25%. Yeah. If you pregnant, you're not taking medications, the chance of having infected baby will be about 1 in 4. Chance of having HIV in your baby. The most risky situation would be blood transfusion. If you receive blood transfusion from infected source, then you 100% will get the HIV infection. Sexual transmission would be 0.3% or 3 in 1,000 as average. But there are too extreme. I've seen people with multiple exposure don't get the infection. I've seen people with one time and then get infection. Now, the chance of getting HIV infection going back to the mother, infected mother, if you're not taking medication, it's 25%. But if you take the medications until the viral load is not detected, it's less than 0.1%. So you see a big benefit of testing, knowing of HIV infection, treating early, then everything can be managed.
So one person asks about the follow-up plan. So during the regular follow-up, like what kind of investigation and the laboratory investigation will do? Like, is there any CD4 count or the HIV viral load? So he said, like, what other laboratory investigation will we order for them for the regular follow-up?
Yeah, so I look at this in two categories. One is to assess the response to HIV treatment, how well they do after the treatment, and that's HIV viral load. I expect it to be undetectable at every visit, right? CD4 is as high as we can get. The second category would be to monitor long-term side effects. That would come as liver, inflammation, kidney, dysfunction or reducing kidney function, cholesterol, diabetes, bone health, chest x-ray, making sure there's no tuberculosis, for instance. And there could be more intensive monitoring if I feel that my patients are losing memory, if they're not as sharp as before. Maybe we do some neurocognitive assessment or assessment of your brain function, your intelligence function, and stuff like that, because that's one thing that can come with chronic HIV infection, and we have the way to help it, to reduce it. And one of the way actually going back to exercise, because exercise has been the only proven prevention for dementia in general population. So we also use that for our HIV infected patients as well.
Let's see. Next question is, how many steps of HIV screening to confirm that the person has HIV infection and need to have treatment?
Yeah, so great question. We, under WHO and also here in Thailand, standard would be we do 3 types of screening tests, right? So when we call people for true HIV infection, we do 3 types, 3 different technology assays, right? And then if all 3 are positive, we call it true positive or having true HIV infection. If, let's say, 1 is positive, the other 2 is negative, or 2 is positive, the 3rd is negative, we call it indeterminate. Indeterminate means 2 things. It could mean this is false positive. Maybe you don't have an infection, but you just have the antibody looking like antibody to HIV. Or it could be an early infection. Maybe you were exposed a week ago, and then you just develop a low-level antibody, and our assays can only detect certain amount, right? So if that's the case, then I would repeat it again in 1 month time. Or I could send a confirmatory test like HIV PCR. PCR is a technology to detect the DNA of the virus directly, right? So that's the way we confirm it. So we either confirm it, well, it's all with history, right? Compatible history, screening tests, using PCR as confirmatory test, or using an appropriate timing to repeat a screening test again, which is ELISA test in 1 month, for instance. And so we can always prove whether you have HIV infection or not. Some of my patients might have heard about HIV NAT. N-A-A-T. NAT means nucleic acid amplification test. PCR is more specific. NAT is to detect any types of nucleic acid materials like DNA, RNA. Are we going too deep? It's okay, right? So DNA, RNA, right? So NAT can be detected very early, let's say in the first 3 to 5 days.
3 to 5 days.
But again, though, if you detect by NET is overly sensitive. So if you're positive NET, you need to confirm it with, let's say, ELISA at appropriate timing again anyway, right? So by having positive NET, don't just label yourself that you do have HIV infection. I had 2 cases who had positive NET, and we proved it with ELISA and PCR, and that those 2 gentlemen were proven to be having no HIV infection. So before you conclude anything, please see a proper specialist and making sure you get the right technology and right interpretation as well.
Let's see. So, how long can someone live with HIV without knowing? So it's mean like the patient not come for, not treated, not go untested. So
right, yeah. In Thailand, we did that study early on in the beginning of the epidemic, and it turned out to be that if you have HIV infection, if you don't treat it well, you will live about 7 years on average. And then things will start to happen, and then, you know, go through opportunistic infections and many things, and you will know,
yeah, let's see. So, for the cases of like HIV infection, and also they have like some kind of sexual problem, like erectile dysfunction, most of the doctors, they advise like injection testosterone. So whether like the injection testosterone is suitable for the HIV patient, or like he said, like he has a patient who has high blood pressure. So whether like this kind of testosterone injection is it suitable?
Well, you know, if you have a clear medical reason for testosterone injections, then it's okay, definitely okay. But I've seen a lot of cases who actually don't have a clear indication for testosterone. The clear indication would be you need to prove that your testosterone hormone is low. Then you replace it, right? If you replace it, then it also brings back your sexual life. It also prevents from the bone fracture too, right? But if your testosterone hormone is normal, it's no point to get testosterone injection, because what it will do is that it will stimulate the growth of prostate gland cells, and that will lead to prostate cancers. And it's not, you know, it's not pleasant to have another disease, you know, by an unnecessary treatment. So for HIV it's okay, but I just want to make sure that you do see a clear medical indication for testosterone injection.
I see. Okay, I think our time is up. So before closing our session, if you have any take-home messages to our audiences.
Well, you know, like I said, HIV is a manageable and treatable infection, but, you know, the most important thing would be to come forward for HIV testing. Please look at HIV testing just like another test, just like blood sugar, because that's the entry point of you to take good care of yourself. You know, by having HIV testing regularly, it will, you know, affect your life in a very positive ways, and you can enjoy your sexual life in the way you choose.
Let's see. Okay, so thank you very much for your attention and all the questions. We are sorry if we don't have enough time to answer all the questions because of the time limitation. So I hope this live session will help you to understand more about HIV. So please also stay tuned for our future interesting topics at Bumrungrad International Facebook page. And also, if you would like to consult by telemedicine to our doctors, you can contact to our referral officers and also our Bumrungrad web page. So this is our Doctor Talk, our Facebook live session. And thank you very much. Have a good and healthy day, and see you again.